Hello everyone, it's Dr. Zach Borus from Dickinson County Board of Health and Lakes Regional Family Medicine in Spirit Lake, Iowa. I'm going to take off my mask because we're socially distanced, but thanks for joining me. It's been a couple weeks since I last came to you, so I just wanted to give you an update as we come into the holiday season about where we are with COVID here in our county, here in our hospital, testing, as well as just the state of affairs in Iowa with some new information and some new asks. So, first off, happy Thanksgiving this week. This should probably be posted the day before Thanksgiving, so hopefully everyone has a restful, safe holiday. I want to talk a little bit about ways that you can make that safe or safer. I want to talk a little bit about the governor's proclamation from last week and what that has done and what that has changed, so that everyone is aware. Wanted to talk a little bit about Test Iowa, about things that are going on up at the hospital and how we really have seen an uptick, and some outreach that we're doing, as well as ways that you guys can help. So first off, ways to have a safe Thanksgiving. So our best advice is following that of the CDC, which is stay just with your immediate family, the people who live in your home, in order not to spread the virus. That said, we know that some of you are planning to get together with family, friends, etc. So what can we do? First, keep it as small as possible. Okay. So the governor has limited indoor gatherings to no more than 25 people. Ideally, you stick with one family other than your own, if that. Decide if it is worth that risk, however, because if you are coming into contact with people who, even if they've tested negative, who are pre-symptomatic and who could have already been exposed, they could get you ill, they could have you out of your job for a few weeks, they could potentially get other people who are more susceptible to getting severely ill from it as well, and there's ripple effects. So consider that risk, and if you can, just stick from home or stick with the folks who you live with and Zoom in others. Luckily, we live in a time where we can do that. My mom's planning to Zoom in from Connecticut. My brother will be there from Chicago, and my sister-in-law will be there from DC. So we're going to get together, just a different way. Other things that you can do: wear a mask when you're not eating. We know that this is spreading inside of buildings. So if you are choosing to be with people who aren't usually in your circle, wear a mask. Take it off when you're eating. Ideally, distance while you are eating, so perhaps sit at different tables or in different rooms, different areas of the room, and spread out a bit. Third, use a lot of sanitizer. So if you are serving food, sanitize beforehand, and if you've got a buffet, try to have it so that there's one person serving rather than multiple people grabbing the same utensils. Open a window, and then again, mask up. Those are the big things. Also, stay home if you're feeling ill at all. Stay home if you have a known exposure, or stay home if you have a suspected exposure. That should be happening anyway. With the governor's mandates, as I said, there's some really positive efforts in there, and we are so thankful that she has changed course a little bit and come down on the side of safety. So she does encourage a mask mandate throughout Iowa when you can't be 6 feet or more away from other people. So really, that should be whenever you are inside. If you're sitting at a desk in your own office, okay, you can decide whether you want to do that at that point. However, if you're going into a store, if you're going into a church, if you're going into school, if you're going into really any business, if you can, wear a mask. Please, it's the way that we can help keep people safe and keep our economy open and really try to slow this down. Additionally, she limited gatherings to 25 people inside, 100 people outside, and also expanded some limitations on spectators for sports, limited youth sporting events, and increased the social distancing requirements for bars and restaurants. All of these are really positive efforts that will make a difference as long as people follow them. So please be responsible, be a good neighbor, and follow them. Here at our hospital, we have been very, very busy. We have a varying capacity based on staffing and based on specific types of beds available, but we have been close to capacity for much of the last 3 weeks, and there have been days where half of that capacity has been COVID patients. Part of that is because people are sicker. Part of that is because we're not able to transfer folks out either to nursing homes or to referral centers, because those places are also full or near full. And part of it is that, you know, we feel comfortable taking care of these folks, whereas even 3 months ago we wouldn't have. So we have all of the treatments that are available in bigger hospitals here, and we feel comfortable and confident taking care of everyone. But, you know, our staff is getting tired. We've had a few folks out with the illness and other illnesses. Thankfully, we're not in crisis mode yet, because, however, lots of nearby hospitals are and are having to bring in vast numbers of traveling nurses and others, which really is not the most effective care and is costly, and makes it so that they're not able to run it as effectively as they could. So for us, please do your distancing, do your masks if you can. You know, we're going day by day based on our census here at the hospital as to whether or not we're doing elective total joint replacements. We canceled 3 on Monday. If you were one of those people, I'm sorry, we will get you in. But we're super busy trying to catch up and trying to take care of the load of COVID. So thankfully, we have not seen any deaths in our county for about a month. We're still at about 11 people, but that lags hospitalizations, which lags the numbers of infections. So we're up to over 1,200 infections in our county, almost 1,300, and the numbers from Monday, which are usually the highest of the week, have not yet dropped from Test Iowa. So I expect that to be significantly higher within the next 48 hours. In terms of Test Iowa, we are open today from 3 to 5, so you've got another 2 hours to go get tested. And then tomorrow we are closed, and then Thursday we are closed. On Friday they'll be open 7 to 9. Jennifer, is that correct? Yeah, okay. So you will be able to get tested. For those of you who are coming and getting tested, we know that it is not fun to stand outside. We know that it is cold. At the same time, we could not figure out a better way to do it than to move it inside a couple weeks ago, because our supplies were freezing and our nurses were freezing. So please be patient. Please be kind to one another and to the nurses when you get in there. We are experiencing volumes that we have not seen before. There are days when we're testing more than 300 people in, you know, a 4-hour period. 4 to 7 hour period. So it's a lot. We are putting people through as quickly as we can, and we know that sometimes you do have to wait, and that's frustrating and a little bit scary, but keep your social distance in the line, wait your turn, and you'll get taken care of. If you're in line at the end of the time period, we will get you in. Pretty much everywhere else in the state is doing this by appointment and has significantly lower capacity than we have been able to do. So, you know, we know people are getting frustrated waiting, but please be kind to one another and to the folks who are testing you. And if there's technical snafus, be annoyed at the state, not at us, because we have no control over it. We'll do our best to get you taken care of. And we plan to continue Test Iowa as long as we are able to, which will be hopefully months and months from now. In terms of outreach from the hospital, we are doing media things like this. The Board of Supervisors, the Hospital Board and the Public Health Board both have sent letters, or sent a joint letter to the Board of Supervisors, and we met with the Board of Supervisors this morning at their meeting, and we have requested that they implement a local mask ordinance. Sounds as if they were very supportive of supporting masking and supporting mitigation guidelines this morning, which was very heartening, and we appreciate all of their time and thought on that. And they committed to putting out a proclamation within the next week supporting masking and other mitigation strategies. More on that to come. It may not look like an actual ordinance, but they are very much in favor of protecting our community and keeping hospitalizations down. So again, thank you to them, and thank you to all of you for doing your part. The last thing is we're getting a lot of questions about vaccines, and so this is finally the light at the end of the tunnel. So we hope. There are 2 vaccines that are looking like they're going to ask for emergency use authorization within the next week or so. That's from Pfizer and from Moderna. Both of them have shown to be 95% effective in reducing significant illness from COVID in the first phase of study. within the phase 3 trial. Both of those are tens of thousands of participants. There have been very few negative side effects from the vaccines. And so questions that we're getting are, who's going to get it first? When can I get it? When's this all going to be over? And those are great questions. Depends when the emergency use authorization goes through. If that is approved within the next few weeks, then I think it is reasonable to think that by the end of the year, we will have some vaccine here in our county. We're not sure yet whether that will be the Pfizer one or the Moderna one. That will likely, at least at this point, go to healthcare workers first, and then it looks as if in Iowa the second part of that first tier will be long-term care facility residents, as there have been a number of outbreaks, as I'm sure you've heard, in long-term care facilities, and those are some of our most vulnerable people. They appear to be safe. They appear to be very effective, as I said. We will know more as things go on, but I, for one, am going to jump on board and get my shot as quickly as I can, because it's the one thing that I can do to help protect myself and protect my family, in addition to masking and wearing PPE all the time. I will continue to mask, and I encourage you all to do so, even if you've had the illness, because, again, it sets an example for the community. Also, you can get reinfected, or you could potentially spread it to others, even if you are outside of that 10-day window. So going back to the vaccines, there's hope, and we are thinking that most likely we will have mass availability of these vaccines probably sometime in the first quarter to first half of next year. Hoping sooner, we'll see. But more testing and more rollout has to be done, and more manufacturing has to be done. But they are talking as if they have the capability to make a lot of it in a short time, and that's what's been great about this Project Warp Speed, that they've been able to manufacture as they've been testing. So more to come. We will know more, and we will share it with you. But you know, really, we are at a tipping point here. I think we have the opportunity and the ability to slow this down, because it has been rampant, and I think that the governor's measures last week are going to start having an effect already. We encourage everyone to be even more cautious, even more wary, especially as we go into the holiday season where everyone wants to gather in person. Please think about it before you do so. Please continue to socially distance. Please continue to wash your hands and wear your masks. And we'll get through this together. So take care of everyone. Take care of yourselves. Take care of each other. And have a wonderful holiday. Thanks very much.